event was about the visit of the Minister of State for Higher Education, Honorable Dr. Chrysostom Muyingo, the Minister of State for Higher Education. He had come to monitor the examinations which are going on, which are conducted by Uganda Health Professions Assessment Board. We are happy as an institution that we have again received the minister. He was here in 2023 for the graduation ceremony, and we hope that he will come again. Specifically on his visit, he has highlighted a number of issues which we believe will help government support the institution. School of Hygiene has received a lot of support from government. We've received grants which are supporting instructional materials, payment of staff, and also utilities, as well as maintenance of the institutional buildings. Last year in December, we received a new bus, Isuzu Master Bus, which we have added to our fleet to support fieldwork. This is another very great milestone in supporting the training of health professionals in Uganda. As a school, we still have a number of challenges, which the minister has alluded to and has highly recommended.
Today, I'm here to monitor what's happening, the progress of the examination, our national examinations. I want to tell you, I've noted the road. I have had the time to go through many of the instructions, but I want to tell you, yours is the best. I love the orderliness, the order. I've loved the trust you have, the confidence. So the rest we shall see when we are marking, after your mark. But I get an impression that you are going to be professional every day, become more professional, and serve God and the country with one clean hand. Very orderly, very disciplined, yes. Confident. Yes. God bless you.
Dr. Honorable Joseph Muyingo is here to greet you. He's monitoring your results.
I tell you, when you start talking, people forget that there is a lunch here. My dear students, thank you very much for the warm reception. Thank you for Mbale. Tulina ebigezo by'abasawo bigenda mu maaso mu ggwanga lyonna. Naffe kuba nti minisita ye supervise wa department ezikola ebigezo, ndi wano okulaba nti ebigezo bitambula bitya. Nsanyuse nnyo okusanga nga abaana environment mwe bakolera ebigezo, olaba order, olaba discipline, olaba abantu bateekeddwa obulungi. Nebaza Omukama Katonda n'okulaga nti teri mwana asobola kubbakiriza ate nga ddala okiraba. Nebaza aba candidates, nebaza abasomesa baabwe ne institutions ezitendeka abayizi baffe abo, kubanga ndaba engalo buli kimu gyekiri. Wabula ne mbasaba era nja kwongera okubasaba abatukoledde amasomero amangi ago, tufeeyo nnyo ku standard n'okuwulira amateeka nga bwegagamba tugagoberere. Byonna byogerwanye nga tugagoberere nga bwe gatuweereddwa naddala National Council for Higher Education kyetugamba ku level yaffe eno. Tutwale nga kintu kikulu era tukolagane n'aba ministry bulungi okulaba nti abaana baffe bafuluma nga bajjudde ebo abasobola okubeera employed mu Uganda, basobola okubeera employed n'ebweru, who can outcompete others.
I have accompanied the Honorable Minister of State for Higher Education, Honorable Dr. Chrysostom Muyingo. Honorable came to monitor how the examinations of Uganda Health Profession Assessment Board are being conducted. You recall very well that these exams started on 15th of June, and until today they are still going on. We have been told they will go on until the end of this week, which is tomorrow anyway. We came mainly to accompany the minister for him to monitor and evaluate whether these exams have been done very well, whether the right exams were provided, whether the resources that were required to be used during examination, including the assessors, the invigilators, the coordinators, the human resources that are required to be at the examination centers, whether they were prepared and they are available, whether the resources, materials for sitting this examination, the space, the skills laboratory, the equipment, and all that, and to confirm whether examinations have been kept safe at the police and also safe at the examination centers. What we have noted, we visited the three institutions, we have noted that the institutions that we found here in Mbale, the Mbale School of Nursing and Midwifery, the Mbale College of Health Sciences, and the School of Hygiene in Mbale, they were all in a position of well preparedness. We noted that everything was done according to the instructions that were provided by the board, but also according to the instruction of training as a professionals. As a Commissioner for Health Education and Training, I want to express our appreciation to the management of these institutions. Two of them are for Government of Uganda and one is a private institution. But we found that all these three institutions were at the same standard without any differentiation, meaning to us that the health worker that will be produced from these institutions will be of the same value, whether from a private institution or a government institution, we have followed the same standards to produce them. Thank
Uganda Allied Health Professions Assessment Board was established after the TVET Act, where it merged the former Allied Examination Board with the former Uganda Nurses and Midwifery Examination Board. Now, this one is one board which has absorbed the two, the nursing and the allied. And since then, we have been working together. Now you can identify that these are nurses or these are allied. We work together. And the principles of assessment remain the same. The main objective of conducting assessment is to establish whether training took place, whether people who are going to the field of work are competent enough to meet the needs of the world of work. So, in principle, we have to make sure there is integrity, there is objectivity, there is reliability in all the processes. And we don't just do that as an assessment board. We work together with all the partners, the training institutions. That's why even when you came here, you find many of the assessors are from other institutions, and those who teach here also in other institutions. And what is even interesting now, whether it is a nursing school, you find an allied assessor has been deployed there. The nurse is also deployed to the allied. So that is how well we are working.
Let's go. Smile.